Dr. Burgess is going to go on and get the opening statement started, and then we'll be right back. Yeah.
So again, welcome to our witnesses. We'll first hear from Mr. Jason Shandell. 5 minutes for opening statement, please.
Thank you. Good afternoon, and thank you for this opportunity to testify. I'm Jason Shandell, Vice President and General Counsel for Amphastar Pharmaceuticals, which is the parent company of Armstrong Pharmaceuticals. We're grateful to the members and professional staff of the Energy and Commerce Committee for their assistance in helping us to hopefully distribute the remaining units of Primatene Mist. We strongly believe that allowing Americans to have access to Primatene Mist is better than leaving it to expire in a warehouse in California. Primatene Mist, an epinephrine inhaler with CFC as propellant, was developed by Wyeth Labs in July 2008. Primatene Mist is approved for temporary relief of occasional symptoms of mild asthma. There are at least 2 to 3 million loyal Primatene Mist users in the U.S. When our company purchased Primatene Mist brand in 2008, we knew it would be going off the market and that there were technical challenges in creating an epinephrine inhaler without CFCs. This is referred to as Primatene HFA. We accepted the challenge, and in fact, we have developed Primatene HFA. And we are targeting to file a new drug application with the FDA in the 4th quarter of this year. Because Primatene Mist was removed from the market on January 1st, 2012, there is currently no over-the-counter inhaler for asthmatic patients on the U.S. market. An individual who previously used Primatene Mist must now pay to see a doctor and then buy a prescription inhaler that costs 4 to 5 times more than Primatene Mist. We've received thousands of inquiries from users of Primatene Mist who are desperate for availability of an over-the-counter inhaler. Unfortunately, these inquiries have also cited 2 possible deaths because of the lack of such an over-the-counter inhaler, and I have these emails here. Last December, we submitted a request to the EPA to allow for the sale of the remaining units of Primatene Mist based on public health and economic interests. The public health interest is growing since the untreated and undertreated asthma patient population is largely comprised of uninsured, economically disadvantaged, Black and Hispanic communities. This includes a large number of women and children. Without Primatene Mist, those asthmatics who have no insurance, they may have to seek care in emergency rooms, which can take many hours and cost thousands of dollars. The company's request for enforcement discretion was denied by the EPA on December 30th, 2011, citing that it would not be in the public interest to allow for the sale of the remaining units of Primatene Mist. Since the EPA did not address the economic factors raised in our original request, we again requested enforcement discretion from the EPA on January 4th, 2012. The 2008 final rule stated that removing Primatene Mist from the market will cost consumers between $300 million to $1.1 billion. That is based on 2007 estimates. The cost to the federal government and taxpayers for Medicare and Medicaid could run as high as $75 million in each program, not to mention the severe financial burden that an emergency room bill can place on a family. We have not received a response from the EPA on this subsequent request based on economic concerns. Amphastar understands that members of Congress have also written to the EPA expressing their concerns, and they have not received any response from the EPA as far as I can tell. The company has repeatedly asked why Primatene Mist was pulled from the market when actually there are 2 prescription drug inhalers that also use CFC as their propellants, and they have been allowed to stay on the market through December of 2013. No one from EPA has ever explained why these 2 inhalers with CFC are allowed to remain, but Primatene Mist is not. Primatene Mist has been on the market for almost 50 years and has a safe and effective track record. To remove Primatene Mist from the market because it contains CFC with no over-the-counter replacement inhaler jeopardizes the health and safety of the 2 to 3 million Americans that have relied on this product for many years. Amphastar believes in putting people over profits, and throughout our efforts, we have offered to distribute all of the remaining units of Primatene Mist as a donation to public health clinics. This offer has been rejected by the government. We are not interested in profiting from the sale of the remaining inventory. Therefore, we hereby commit that we will donate all the net profits from the sale of the remaining units of Primatene Mist to charity. Amphastar believes in its product, Primatene Mist. It should be available in the United States over the counter so individuals who are suffering from asthma and depend on this product can enjoy instant relief when they experience asthma symptoms such as shortness of breath. We sincerely believe that there must be a readily available over-the-counter inhaler for Americans who have difficulty accessing a doctor to obtain a prescription and cannot afford to pay 4 to 5 times more for a prescription inhaler. In closing, let me again thank the members of this committee, specifically Dr. Michael Burgess and also Congressman Mike Ross and your professional staff for holding this hearing. Our goal is to get the remaining units of Primatene Mist out of the warehouse and into the hands of the American people. Thank you.